But now interventions are turning the tide. The Setra East District Health Directorate brings relief to those in the shadows. Evans Edu Brown is the District Disease Control Officer.
We are currently in Tunkumso. We've seen about 50 cases, 20 of them to scabies, and then the others are lymphatic filariasis. That's the NTDs. So currently, the serious ones are being referred to the facility for treatment. We are treating the minor ones here. The serious ones are being referred to the facility.
Here is Dr. Emmanuel Tenkora, the Ashanti Regional Director of Ghana Health Services.
Most of these neglected tropical diseases can be addressed through community-based interventions, with the support of the government. So in the community, we need to do what we call community sensitization and then screening in the community. Because most of these diseases, they don't come to our hospitals because the people are not acutely ill as we know. So maybe they'll be hiding in their houses. So we need to do what we call case set sometimes, even to identify those cases. So the role of the community is very important. That's the reason why we need to do a lot of community engagement so as to increase awareness about these diseases and then support the community to know where they can go for treatment in event they have some of these conditions. So the community-based activities are very important, and that means that we need all the leadership in the community to help.
All what we are preaching and saying to the general public is the early reporting of any suspected case to the nearest health facility for case management.
The cases that have been taken to the hospital are being monitored closely. We are monitoring them closely so that the disease doesn't become worse there, and also the minor ones in the communities are being monitored too, so that it doesn't get to the severe stage. So currently we are still doing active case search so that we get most of the cases treated.
Daniel, Ifia, Kojo, Rahel and others are reclaiming their lives. For example, Kojo is currently undergoing medical care provided by healthcare professionals in the district. Nora Ado serves as a midwife at the Alukwaso Health Center.
As the monitoring team was moving around today, we came to find Mr. Kojo Asare, and then we discovered that he has defaulted. So we educated him, and then we plan to do small dressing on the wound for him today in the house, so that the subsequent days he will come to the facility to continue with his dressing.
I express gratitude to them in the name of the Almighty God for addressing my problem. I have faith and trust in the Lord that if this positive trajectory continues, everything will eventually be well for me.
37-year-old Dasemani Akuguri from Teteku has successfully overcome his leprosy condition.
My advice to you is that if you notice any signs, it's essential to understand that it may not be related to witchcraft. Instead, I recommend visiting the hospital for proper medical attention. In my experience, when I sought medical help, it proved to be beneficial. Initially, it started as small balls on my body, accompanied by itching. However, when scratched, it resulted in the formation of black spots on my skin.
Nana
Obuo Frema Pokuya Defijasi Bamohima expresses gratitude for the timely intervention of the Health Directorate, which has brought a sense of relief to them. She emphasizes the importance of parents actively monitoring the healthcare needs of their children.
About time, the best
especially secondary schools.
I am advising parents to establish a closer connection with their children, as this would enable them to identify any sign of disease at an early stage. This proactive approach is crucial in preventing the spread of the illness within the family and beyond.
Kan abusuamu ni nyina o maame no papa ne nuanom nyina na kofo hawo kese e aba.
Nsutam Ankobia Heni Nana Yao Buahin comments Nana Pokuya's statement, adding his agreement with the importance of parental vigilance in monitoring their children's health care.
And media dance a fire doctor no edibaye hu. And so ano e no kre me ba penny o wie school a fiscal bra o baye no. I
can testify what the doctor said. My family also experienced the disease, which was transmitted by my elder child who contracted it in school. After learning about the condition and the necessary steps to address it, I diligently took action. As a result, my family is now free from the disease. This underscores the severity of the illness, emphasizing the importance of seeking prompt medical attention rather than being hesitant if symptoms are observed.
Patricia Amani, a resident, is thrilled by the community outreach as it is instilling hope and empowering individuals to combat the disease.
We express our gratitude to God and are immensely pleased that the health workers came to educate and treat our ailment. From now on, we commit to supporting and participating in this program.